What's your doctor not telling you about food?
Pretty much not telling you everything. Doctors don't get any nutrition education or such a small amount. I teach nutrition to Stanford med students. I get 4 sessions their entire career. And each session is 20 minutes of lecture and a whole bunch of time doing case studies. I get 80 minutes
You got 80
with the
minutes.
Stanford medical school class in all the years they're there.
So I asked you, what are people's doctors not telling them about food? And the answer is everything.
Yes,
What's your doctor not telling you about food?
pretty much.
Good morning, good morning. Thanks. That is, he is a professor at Stanford University, and he teaches medical students. That is
Okay.
Christopher Garner. All right. He teaches medical students nutrition, and as you can see, what he explained. Look how much time that he gets to teach nutrition to medical students, and this is throughout their entire educational lifespan with regards to what they learn in med school. All right, so he gets when it comes to lecturing in particular 80 minutes, right? Now there have been standards that have been put in place because this is an issue that have been plaguing medical schools for a while. So if I share my screen here, I just did a simple search engine search, and you would see here research in nutritional training in med schools, and look what pops up. First thing, it says, although nutrition education varies by school, a 2021 survey of medical schools in the US and UK published in the Journal of Human Nutrition and Dietetics found that most students receive an average of 11 hours of nutritional training throughout an entire medical program.
Right.
So in 4 years of med school studies, they get on average 11 hours, which means some get less than that, others might get more than that. Since 1985, it was an issue, and the recommendations is for no less than 25 hours. But of course, most med schools don't reach that. Then the other thing is, not because one get the 25 hours mean that they are getting substantial information. In fact, what these studies and research show is most of it is in regards to culinary arts, basically.
Okay.
Kind of like learning to cook and stuff. And as he also mentioned, case reports, but not so much understanding the implication of nutrition with regards to disease prevention and the disease reversal. So what they might study in the lectures might be anatomy, or with regards to nutrition might be things with regard to nutrition, anatomy, physiology, the metabolic process, those things which are not necessarily applicable with regards to disease prevention and disease reversal. So you might know the Krebs cycle, right? Or the benefits of, let's say, vitamin C, what vitamin C does to the body, but not the interaction with these things with regards to disease and disease prevention, or what you might eat that might block it, and what you're supposed to eat based on the biomechanics of the body and so forth.
Yeah.
So when people take nutritional advice from doctors, they think it is sound. It isn't. It isn't. All right. And keep in mind, medical doctors are trained in medicine, pharmacology. So they are trained to push and promote the
Right.
pharmaceutical drugs. That is the reason why since 1985, the nutritional education aspect with regards to doctors is an issue. Since then, since 1985, how is it that cannot be fixed yet? Right? The reason why it cannot be fixed is because it is not in the best interest of stakeholders to fix it. If
Okay.
emphasis is focused on nutrition and not supplementation and medication, then it means diseases would not be prevalent, and therefore people would avoid diseases or reverse the diseases that they do have.
Leading
And
to a drop in
pharmaceuticals.
sales of pharmaceuticals, yeah.
Not just that's a major drop.
Yeah, we're talking about
In sales for
$1 billion.
pharmaceuticals.
We're talking about $1 billion industry.
Correct.
Yeah.
Right? I wonder if it's $1 billion or $1 trillion industry.
It
Yes,
could be
well
$1 trillion.
$1
It could be $1 trillion,
Right.
because I mean, everybody in the world, or the large majority of the population, we're talking about what, 7 billion people?
I think we're up to 8 billion now.
Well, right.
Somewhere around
So,
there.
okay. So if we had anywhere between 7 to 8 billion people in the world, from the time you're born, you're on medicine. You're on some form of medication.
Well, not me, but
Well, I mean,
Right.
the vast majority of people, right?
but yeah. So
Yeah.
that's a lot of money there. And the thing is, people need to understand that doctors that have an understanding or better understanding of nutrition, they have to do their own research.
Okay.
The interesting thing is when people hear that I do my own research, oh well, you're not a doctor, so,
But
there's
you've
this,
never
that.
claimed,
But-
never claimed to be one.
Exactly. Now the next thing is doctors still have to do their own research on nutrition because they are not taught much on it in their schooling. Now I have friends that are doctors, so I could tell you that.
Okay.
Right? I've spoken to them with regards. It's like when we did that in the earlys and forget that, and what they would have done was simple basic stuff in it. Right? Simple basic stuff in it. And we're out here, and it's because of what they were trained with regards to nutrition. This is why a lot of people think that diseases are just things that you get just on. It's not associated with your diet. Your
Right.
diet is the #1 contributing factor to all, not some, to all. Every single disease that exists, your diet is the #1 contributing factor to it.
Yeah.
But a lot of people don't want to hear that, because another thing with the medical field is they don't like to offend, or they want you to feel a level of comfort. So I will try to help treat you without telling you that you really need to change your lifestyle. You don't want them to make too much big changes because they may not like you, right? That's the impression that I get. It's like, so you know what? Yeah, you could drink a beer a day, right, or 2 beers a day. That's fine, right? While alcohol in the scientific community is classed as a poison, right?
Yeah.
But the doctor will say, yeah, having a couple beers a day, that's fine. That's fine, right? No amount of poison is fine, right? None, right? But people want to hear that because we want to continue.
Well, not only that too, but if I was to take a small dose of poison every day, eventually I die.
It is what we call accumulative poisoning.
Right, so eventually it's going
Right.
to start, it might not affect me in the small dose that I take on day
And
one.
that is the thing.
But
A lot
as
of
I
people
go
are
along,
like,
yeah.
and when you show people certain things, they would say, well, that ain't going to affect me now. The time that it starts to affect them is the time that they want to live the most.
Yeah, when you get along in age, yeah. When you're young, you don't really take, yeah.
You're not taking it on. And
Yeah.
when you really want to hold on and cherish life, that
That is
is
when
when
you-
the sickness and disease start to step in. So youth is wasted on the young.
But, and
That
then
saying
to,
is a true saying, isn't it?
and then to set, by that time, as you have aged, you have been so set in your ways, and your routine, and the things that you've become accustomed to, that it is very
the
hard
addiction.
to reverse. It is very hard to reverse the
The effects or
yeah,
the behavior.
the
right?
behavioral pattern. Yeah.
It's not
becomes
impossible,
harder.
because I have done it with clients. There are many clients. Again, the woman with the cataracts, she really
Yeah,
wanted her hypertension, her fatty liver disease, and her cataracts to go.
Yeah.
So she made the changes, and after 7 months, they are all gone. Right?
Right.
She made the changes, and she's reaping the benefits of that. Right? There are studies showing, because we talk about aging, there is data showing that aging and poisoning is the same thing. You know, we age because we are being poisoned. This is why you had people in the past living for so much longer than you have today, right? Because aging and poisoning is the same thing.
Yeah.
In Trinidad and Tobago, dying under the age of 74 years is classed as a premature death, which means the majority of deaths in this country is classed as premature deaths.
Yeah.
Premature deaths means that you died before your biological system should have died.
Okay.
What are the factors that influence that? And these factors are what we are consuming. That is the major contributor. But a lot of people don't want to hear that they need to make changes, right? They don't want to, because those changes would mean that lifestyle practices have to change as well, right? And if we are not willing to make those lifestyle practices, then I don't know if you have seen it, but notice that sickness is getting younger and younger.
Yeah,
right?
you're seeing
it's getting younger and younger.
You're seeing people in their 30s and the 20s dropping down with all kind of thing now, man.
Yes, and the thing is, people are going to wait until it's too late. We like to do that. We aren't preemptive, right? We like to wait until things get very, very bad, and then we go in and say, and then we look for someone else to try to fix our problems.
Yeah.
That's what we do,
Yeah,
right?
man.
So, the problem we are going to be faced with very soon is infertility. Infertility among the young people. Say, oh, but the young people having a lot of kids and things. No. If you know how to read data, you're going to see that something coming up just now that's going to be frightening, right?
Okay.
Infertility is going to hit us and hit us hard. Trinidad is already an aging population. People don't know that, huh? Right? We're already an aging population. But infertility is going to hit us very hard and severe because of how we are consuming. A lot of young people, and I could tell you, especially with regards to young men, because I've had a lot of young men contact me under the age of 30 and they suffer from erectile dysfunction.
Okay.
Right? Under the age of 30, and it's very common. Many of them don't like to speak about it, but it's very common. We only look at the fact with females that suffer with the PCOS and adenomyosis and endometriosis and the fibroids and stuff. We only look at it from that aspect. Because women would speak more about all these things. But men, when issues start to affect them, they kind of go into the shell and try to hide from it. But these issues are...
Men feel embarrassed in anything to deal with that.
Embarrassed because sometimes females will throw that in your face and embarrass you.
Exactly,
right?
yeah.
So because of all of that, they stay quiet with it. But it's a pressing issue. It's a pressing issue. And that is what I do with my clinic. I re-educate. I utilize the highest degree and principles in science to re-educate, right? I have even encountered doctors that don't even know how to research properly. Right? Many of them research by looking at what another doctor would say. I go straight to the research papers and I look for the highest degree of studies. Remember, I did this segment on the hierarchy of studies in health science, right? Showing to get people to know how to read data, because that is of extreme importance when it comes to knowing or separating fact from fiction.
Yeah.
And many people don't know that.
People have to know what is solid data as opposed to,
yes,
just
they don't know what are showing correlations or just anecdotals. People don't know. Yeah. People would read an article. An article is not even a study, and they'll just think and they'll go
with that and say, I read that article and it said ABC.
Yeah, so a lot of people go here and there, and what that does, because that causes people to lose trust in science completely. Because they think science is, no, it's not, nothing is wrong with science, What is wrong with how you are interpreting the information? Yeah. And you are coming to a wrong assumption as to science because you don't know how to read the data, right?
Yeah.
And when people don't know how to read the data, they jump to all sorts of conclusions, and then they believe that their opinion is more solid than any form of data, and that is even worse. Yeah. That is even worse. So what I do, I clear these things up. Now, understanding what we see here with the little bit of nutritional studies that doctors are exposed to during their med school, this would explain why we can't get one to come and debate me on television, because they knows nothing on the subject.
Well, as a matter of fact, right? as we wrap up here, because I'm out of time, but would you be open next week to just open the phone line and take some calls?
Yeah, I would love that.
Right? Because we really haven't done it. We're always talking about a topic and thing, and but a lot of people I guess would like to call in and put certain questions to you, maybe on, certain things that they
Yeah,
have gone through.
sure.
And
I am always
get your-
open to questions.
Yeah, and some of them might want to pin you in our corner with asking some tricky
Well, people
questions.
could
But
try.
nothing
I
wrong
would
with
love
that.
for people to try, though. I would love for people. I love that kind of challenge.
Right.
Because that could lead to actually some good topics, and that could lead to some good edification with regards to information.
All right.
So I am quite open to it.
So next
Quite
week
open.
Tuesday we'll do that, people. Next week Tuesday we won't stick to our topic. We're just going to open the phone lines. And now that we have the we have the fellas, how we can work that? Don't worry. Okay, I like when let's say don't worry in the back. I like when let's say don't worry in the back. All right. So we're going to work it because now we have a WhatsApp line where we can accommodate calls from anywhere. So it's going to broaden the scope of questions that are going to be coming at you from all people in all different parts of the world. And I know you can handle yourself and you're going to hold your corner, so I ain't worried.
That's not a problem.
But I got to wrap up. We got a funeral to get to. But I want to thank you for joining us this morning. And of course, good information as usual. And I think that food and the information we have about food is extremely important because, like we say, people still believe in cereal for breakfast being a good thing. But we know that anything high in sugar, and that's why people feel it's a good thing, because people tell you when they eat a bowl of cereal, they have energy, but it's sugar.
what I find even more interesting is how could something that doesn't exist in nature we find to be a good source of food.
Of food, yeah. All right,
That
so
to me is quite interesting.
we will chat again next week, man. And we'll open the phone line and hear from some callers. All right?
Yes, no problem.
Nice one. So that is Seth Viola Board. Remember, you can contact him at the Holistic Health Clinic, 761-1952. That is the number to call, 761-1952 or 279-3935.